This is Dr. Kamel again, and a new content for the physical therapy preparation exams for people who are interested to work abroad. So, if you didn't subscribe to my channel yet, please go ahead and subscribe to my channel. I work as associate physical professor of physical therapy in the United States, and I'm a registered licensed physical therapist in the United States, also in United Kingdom and Egypt. I have got my PhD from University of Nottingham in the UK. So let's go for and check our today's content. Some people they might say this is women health. Some people they might say it is something related to musculoskeletal. Anyway, let's go ahead and see what's going on. A patient who is 8 months is pregnant has an abdominal diastasis recti with a separation of 1.5 inch, which almost like 4 centimeters. So in inch and centimeters, which shows the following exercise would be the most appropriate initial exercise for abdominal strengthening in a supine position. Okay, so we have a pregnant woman, 8 months, okay, which is a third trimester, basically, has an abdominal diastasis recti with a separation of 4 centimeters, which was the following exercise would be the most appropriate initial exercise for this patient from supine lying position. Trunk curls, hook lying head lifts, pelvic tilt leg sliding, bilateral leg lowering. Okay. So now we need to learn about diastasis recti of rectus abdominis muscle. We need to understand and know some information about these types of exercise as well. Okay, so basically diastasis recti, we have here the different abdominal muscles. We have the rectus abdominis muscle. We have the linea alba, which is a connective tissue, not a muscle. And we have here the transverse abdominis muscle, which is the deepest muscle layer, okay, and transverse oblique muscle as well. Okay. So what is diastasis recti? It is a separation, as you can see. Look at this distance and look at this distance. Separation of rectus abdominis along the linea alba. So it will take also the connective tissue over here. Okay. It commonly occurs during and after pregnancy due to the stretching of the abdominal wall. If there is a fetus inside the uterus, which is stretching and doing stretching. So this is physiological thing, which is normal thing, which is happening during pregnancy. So this separation, if it is within acceptable criteria, it's okay. But if it is too much, or if it will persist beyond pregnancy, then we have a problem. So strengthening must focus on gentle activation of the deep abdominal muscles, transverse abdominis, while avoiding excessive intra-abdominal pressure or trunk flexion, which might worsen this separation further. Okay. So they give us four options here: trunk curls, hook lying, head lift, pelvic tilt, leg sliding, and bilateral leg lowering. And if you have no idea about them, this is a trunk curl, this is a hook sliding, this is a heel slide, and this is a lowering of legs. So let's look at them one by one now. So what is the correct answer? The correct answer is hook lying head lift. This is a situation of hook lying head lift. This is the most appropriate initial exercise for this patient with diastasis recti. Okay, so the patient basically will be in a supine lying position. Okay, And at in this position, which we call hook lying, you know, why? Because we have slight flexion, as you can see, of the hip and knee, while the foot is resting on the exercise mat over here. And this is a lower intensity or low intensity exercise, safe exercise, and even can be done during late pregnancy. So we are focusing here on gentle activation of the rectus abdominis. So we are not doing too much stress on rectus abdominis. And we also do gentle activation of transverse abdominis muscle without excessive stress. Okay, that's why this is the correct answer for this question. This exercise can be progressed gradually once diastasis recti is below 2 centimeters, so the separation is below 2 centimeters. Okay, so what is the technique of this exercise? The patient will be lying in hook lying. Okay, yeah, this is a male patient, but we can expect the same for a female patient or pregnant patient. Lies hook lying, knees bent, feet flat on the floor or on the mat. Place hands, or a sheet or a scarf to approximate the abdominal wall, and gently lift the head and shoulders just off the mat, so we don't have a complete trunk curl or something like that. It's just you are lifting your head, and shoulders off the mat while exhaling and drawing the abdominals in. So exhale means expiration and drawing the abdominal in, or contracting the abdominal muscles while you are lifting the head and shoulders off the mat. We should avoid full trunk flexion or leg lifting, okay, because this will be too much stress on the abdominal muscles and might result in further separation or worsening of the situation. Okay. So this hook lying head lift actually will approximate the rectus muscles and strengthen the deep abdominal wall safely. Safely. Okay. Let's look at the incorrect options. Trunk curl. This is too much. Okay. For someone in the 8 months of pregnancy, or even just postpartum after delivering the baby. So trunk curl like sit-ups or curl ups significantly increase the intra-abdominal pressure, and this would actually worsen the diastasis recti, especially if the separation is above 2 centimeters. So it is already, a big separation. So, and by doing this exercise, you are increasing the intra-abdominal pressure, so you are increasing this separation. Okay, so trunk curl is not a safe exercise during third trimester, and our case here is 8 months into pregnancy. Okay, and it cannot be considered postpartum as well. Only we can do this exercise if the separation is minimal and below 2 centimeters. How about this option, heel slide? Okay, pelvic tilt head leg sliding is, is not correct as well. You know, so it is, it can be done during pregnancy. Okay, but as pelvic tilt alone, but adding the leg slide will require abdominal control. Okay, so this exercise actually in this situation, activating the rectus abdominis and oblique muscles, and with more intense, and actually also putting more stretch on the linea alba. Okay, especially if the separation is big or the muscles are not ready. So it is too advanced exercise. Okay, and cannot be, we cannot consider this option as initial phase exercise. Okay, especially if the separation is around 4 centimeters separation or so. How about bilateral leg lowering? Actually, this is contraindicated exercise. So you start at this position and you lower the both leg bilaterally slowly. So this is a high level abdominal strengthening exercise. Not everyone can do this exercise. Will increase and create very high intra-abdominal pressure. Okay, will create strong contraction of the rectus abdominis muscle, which will increase the separation. We might strain the lower back actually. This is, I told you, this is too much exercise, and this is completely contraindicated for patients who have diastasis recti, or if in the case of late pregnancy, like our patient who is 8 months into pregnancy. Okay, so what is the correct option? Supine hook lying head lift, as it emphasizes the rectus abdominis muscle and are least likely to increase the separation of diastasis recti. What is the incorrect options? Trunk curl are contraindicated for patients with diastasis recti. Pelvic tilt leg sliding is more advanced. Yeah, pelvic tilt is okay, but the sliding is the problem. Bilateral leg lowering is very advanced abdominal exercise, and it might injure the back as well, causing back pain or back strain, and it is contraindicated during pregnancy. This was answer for today's question. If you are interested to join my BT license preparation course, please drop me a message on this WhatsApp number 001-442-248-7206 or 0020-102-774-3702. If you are interested in applying for the post-professional or the transitional DBT at the University of Montana, United States, we can get you a discount for applying this degree. But just to let you know that the deadline for application for the coming semester will be the 26th of November, I mean this month. So if you are planning to apply, please send me a message and I will send you the required documents and paperwork so we can start applying as soon as we can. Thank you for following me, and thank you for listening to my videos, and I'm hoping that they are useful, and see you soon in new content.